My name is Jessie McGinnis, and I'm the lead practice director for Summit Healthcare Medical Associates in the outpatient setting. How COVID has affected me and my team members is we are now seeing a level of anxiety and stress with patients that we normally don't see because they're coming in thinking they might have a cold or a sinus infection, but also worried that it could be COVID. And when it does turn out to be a COVID positive result, we're not only just treating that patient, now we start treating the whole family. And usually the whole family will come down sick just because they just didn't realize that they may have the virus. And so it's been a challenge for the patients as well as us on the frontline side to be able to calm their fears and their worries that we'll do everything that we can to get them through this very difficult time. It has been a level of stress with the staff that we normally don't see as well, just because they're worried for their well-being and if they're going to take this virus home to their families. So we have had to treat them as well and give them tools to help them protect themselves. And how COVID has directly affected me in my home, I have a 19-year-old son that actually turned ill a few weeks ago, and we were dealing with COVID in my house. It changed everything. I had to isolate him in a room and keep him away from the rest of the family. I had to, mask up and sanitize and go in to treat him. And it was a type of illness that I have not experienced. And I thought, I could handle it because I treat these patients and care for them in my professional life. But when it hit home, it scared me. I was really worried, and it was something that I hope that I don't have to experience anymore in my home. But it is something that I see patients daily have fear in their eyes when they come in. I am part of the COVID team with Summit, and myself and my team members, we have tested over 4,000 patients, and each one is very unique. Each one comes in with a different level of stress, and especially when we have the children that are coming in, and the COVID test is not any fun for anybody. And so it is sad to see them have to go through that when they're already not feeling well. And it's just changed our lives in a way that we're just not used to. The amount of PPE that we're all living in now, that's another challenge. It's affecting living in masks, it's affecting our voices. It's just been a whole different way of living. So it's been different. My advice to the community and to the staff members is take the wearing the masks very serious. It is a level of protection that could really be an outcome in your favor. When you're going to the gas station, put your mask on and hand sanitize before you get back into the car if you can remember to do that, or just keep some hand sanitizer in the car to where you're cleansing your hands before you touch the things in your car that you touch every day. Try not to touch your face, and just wear the masks. You will get used to them. I never thought in a million years that I would actually miss the mask. So when I get home, I'm like, wow, I feel something is different. It's because I don't have my mask on. And so you do get used to it. It's just a new adjustment, but it definitely could be the result in an outcome one way or another. So I just highly recommend wearing those masks and just wearing them when you're out in the community, not just while you're at work, but while you're out in the community doing simple things that you don't even think about. Going into the grocery store, or getting your gas, or just going in to pick up your meal. Just try to, keep that mask on and hand sanitize, and just do the best job that you can, and hopefully it will keep you safe.